Hello, I'm Rochelle Daniels, medical educator at A Woman's Place, and with this presentation, we will be covering traumatic brain injury and domestic violence. Our goal with this training is to help you be able to gain more knowledge about traumatic brain injury, or TBI, recognize the connection between domestic violence and brain injury risk, and support survivors through effective TBI screening and connect them to resources in an empowering way. Please keep in mind that the material covered today may be uncomfortable and activating. Please check in with yourself, prioritize your own self-care, and take breaks when needed. I'm going to have you just pause here and take a minute to think about how would you answer this question. What are some situations in which you may encounter a survivor with a TBI? So whether you are a new volunteer here at A Woman's Place or a new staff member, can you just think of some situations in which you may come across or be working with a survivor of a traumatic brain injury? I would argue that anyone working or volunteering with A Woman's Place, even if you're not working directly with our clients, potentially could be coming across a survivor with a traumatic brain injury. Even if you're just volunteering at one of our admin offices or volunteering at our store, any survivor could have a traumatic brain injury, so this could be something that you will be coming across in your work with A Woman's Place. So what is a traumatic brain injury, or TBI? It is defined as a change to how the brain normally works due to a bump, blow, or jolt to the head, or from the brain not getting the oxygen or blood that it needs. This change can be temporary or long-lasting and can affect a person's ability to function independently. This is fairly common. There's 1.7 million new TBIs every year. Majority of those are caused by a concussion. This is often referred to as the silent epidemic because it often goes unrecognized and is often not disclosed or not treated or not diagnosed properly. A TBI can result from blows to the head, from blunt force trauma, from an object, or from the head slamming against a hard object. Secondary trauma, like from gun violence, like a bullet entering the brain. Rapid movement of the brain within the skull, such as violently shaking. Falling or sudden jerking of the head. This sometimes happens in sports. And strangulation or choking that causes lack of oxygen or blood to the brain. Perpetrators of domestic violence can cause TBI by many ways. Hitting a survivor in the head with an object, hand, fist, or a hard object like a gun. Pushing or shoving a survivor's head into the wall, car, or other hard object. Hurting the survivor's jaw, teeth, eyes, and ears. Shaking a survivor. Strangulation, choking, attempted drowning, or restricting breathing. It's important to note here that choking and strangulation are the most lethal form of domestic violence and intimate partner violence. So we always want to be aware of that if any survivor has shared with us that they have been choked or strangled, or as part of our screening process, if they disclose to us that they have been choked or strangled, we should really keep that in mind, that is an indicator that they are really in danger in the future. Some stats about domestic violence and TBI. 83% of domestic violence survivors have been hit in the head and severely shaken. 94% of survivors report injury to their face. 50% of survivors have experienced multiple traumatic brain injuries. 68% of survivors have experienced strangulation, but only 20% have disclosed it. We're going to cover a little bit later about how oftentimes survivors don't identify being choked or strangled as being abused or being physically harmed. So if someone asks them if they were physically harmed or physically abused by a partner, they may say no because they might not put choking and strangulation into that category. So that's one thing when we get to screening for traumatic brain injuries, about being mindful of the language that we're using. Many survivors, like I said here, don't associate strangulation with physical assault, so we have to be mindful of the language. They also don't associate that they had a head injury if they didn't lose consciousness. So like it says here, loss of consciousness is not a necessary indicator of traumatic brain injury. In fact, only 15% of people will lose consciousness even though they have a brain injury. So these are things that we can have conversations about with our clients when we're screening for traumatic brain injury. TBI is not a new onset mental health issue. It's not emotional stress. It's not an intellectual or developmental disability. And it's not the effects of prolonged drug or alcohol use. It may mimic the signs and symptoms of some of the things listed here, but it is a totally different thing altogether, which we'll be talking about today. In this video, we are going to hear about a clinic that specializes in traumatic brain injury caused by domestic violence. It is very unique. There's not many clinics like this that just specialize in survivors of domestic violence. So we're going to play the video and then talk about it afterwards.
Well, the statistics are alarming. 1 in 3 women and 1 in 4 men have been victims of physical violence by an intimate partner. Neurologists say this can leave them with severe brain injuries that are rarely diagnosed or even treated. But now a top brain injury clinic has made it their mission to help victims and bring needed national attention to this problem. It looks like a sports medicine clinic with player graphics on the exam room walls. Barrow Neurological Institute in Phoenix, many of the patients aren't athletes. They're survivors of a very different kind of hit to the head.
One of my abusers actually grabbed me by the neck and then was pounding my head into the wall until he made a hole in the wall.
I was hit in the back of the head with a pipe. There was not a day I was not abused.
About 81% of the patients we see through our domestic violence program have had so many head injuries they've lost count.
We have a few different views here.
Here, clinicians like Dr. Glynis Zeman and social worker Ashley Bridwell are doing something revolutionary, running the country's first and only brain injury clinic for victims of domestic violence.
At Barrow, we believe the trauma the domestic violence survivors sustain is arguably much worse than what we see in our athletes.
That's the whole idea behind this program, is to give the love and the care and the attention that they haven't gotten. And for many of these women, that's freedom.
Since opening in 2012, more than 300 survivors have been referred here, mainly through partner domestic violence shelters, where women like Deborah were first screened for signs of brain injury.
I'm like, oh, so that's why I've been having so many problems with my memory, and that's why I keep getting told that I'm stupid and, you know, good for nothing.
You said when you came in here, you had no confidence, you thought you were stupid, you were crazy, you were nothing. What do you think of yourself today?
I feel powerful. I feel like I can do almost anything.
Sarah, not her real name, says she was beaten daily as part of a human trafficking ring. She escaped, but her perpetrators are still free, so we're hiding her identity. Her brain so badly battered it affected her memory and balance and caused severe depression. How have they healed you here?
They've healed me from the inside out. They made me who I have become. Going from not wanting to live to I have a future. I have a bright future now.
Over several months of treatment, survivors receive physical, cognitive, and psychological therapy, as well as help finding jobs and safe housing. You said to me, this is my life's work.
This is the defining principle of my life. This work, these people, that moment that a woman finally understands that it's not their fault.
With her service dog, Deborah can now walk without a walker. She thinks clearly again, too, and wants to become a writer. So now you have hope.
Yes. And I want to be able to share that with other people so that they know that this is something that you can recover from.
Sarah has discovered her talent for painting and hopes to become an advocate for other survivors.
We can step up, get more programs like this out here, and let's save one woman at a time.
Do you believe you're saved?
I believe I'm saved, and it's thanks to them.
Oh yeah, this just blows me away.
Yeah, I know. This is so groundbreaking, this program. It's the first of its kind. It's constantly trying to raise money to stay afloat. It hopes that other, hospitals and stuff will copy what they're doing. And it's so moving. I can't tell you, these women, they're so optimistic and they've been so badly damaged. And it's the first time anybody's looking at their brain and treating them with respect.
And when you think about it, I mean, so many of these women have taken blow after blow after blow. We talk about concussions and head injuries in sports.
It's incredible.
You know why? Now it seems so obvious. Thank goodness for this woman who started it.
I spoke to the woman who runs the Domestic Violence Center, and she said, I've been in this field for 30 years, and I'm embarrassed to say that none of us thought to look in the brain.
Oh, just to see football players going in and out of this place.
Yeah.
This woman too.
And so they're excited that they're being treated the same as the Super Bowl players.
This woman who said that she wanted to be a writer, she has an amazing story to tell.
She does. Amen.
So that was very powerful to hear from those survivors who have a traumatic brain injury, and to see that clinic that specializes in TBI and domestic violence. It's really one of a kind. There are resources here in the Bucks County area for those who have a traumatic brain injury. It's not specialized just for survivors of domestic violence, but there are a lot of resources that we will share at the end of today's training and presentation. So recognizing traumatic brain injury in survivors. So some things that you might see working with a survivor who might have a TBI. Difficulty with concentration and memory, easily fatigued both physically and cognitively. So when we say fatigued, not just like physically, like sleepy or like physically worn out, but also mentally. So some survivors have said that this is kind of like a brain fog, like they have a hard time, not just concentration and memory, but their brain is just tired. Communication problems, compromised executive functioning. So this is multitasking or focusing on two different activities at once or two different problems at once. Trouble processing information, easily confused, sensory or perception changes and problems. So sensory, so maybe overly sensitive to light or noise or touch, or perception problems could be unaware, or they have a hard time perceiving or unaware where their body is in space, or so like if their eyes are closed, they can't necessarily tell how far out their body goes, and that could be from the traumatic brain injury. Changes in personality or emotions, so such as easily frustrated or angry or mood swings. Post-traumatic stress and TBI can create symptoms that mimic each other, which could be really confusing and challenging. They also create symptoms that can mimic a mental health diagnosis, such as depression or bipolar or anxiety or OCD. So there's a really high risk for being misdiagnosed or not diagnosed correctly, or for being diagnosed as having depression or bipolar when the reality is it's a traumatic brain injury. So that is why proper screening and proper treatment become really important. Other issues associated with TBI could be sexual functioning, so either inappropriate or hypersexual behavior, or the other end of the spectrum, decreased interest in sex or desire. Sleep disorders such as insomnia, sleep apnea, having problems waking up at a regular time, having problems staying awake during the day, physical issues such as pain, headache, dizziness, sensitivity to light or noise, vision, hearing, or smelling problems, increased clumsiness or balance issues, neck pain or difficulty swallowing, especially if they had experienced being choked or strangled, unable to resume work, school, social activities, financial problems they're all kind of intertwined. So if someone is not able to resume work or school, that could lead to financial problems, which could lead to the next bullet point of being dependent on a caregiver or a family member, which could lead to possibly parenting issues or custody issues with children, which could then lead to the next bullet point as increased substance abuse or self-harm or suicidal ideation or homelessness. So as you can see, these problems or these issues associated with TBI are really interconnected and kind of cascade from one to the other. We also know that TBI has an increased risk of other brain disorders such as epilepsy, Alzheimer's, or Parkinson's disease. Without proper screening and diagnosis, survivors of TBI are often mislabeled or misdiagnosed. So they sometimes are assumed to be under the influence of drugs and alcohol. They could be labeled, quote unquote, crazy or overly dramatic or difficult or a troublemaker. It could be assumed that they are lying or making up information. They could be labeled, non-compliant from healthcare providers or social service providers. They could be assumed to be not intelligent or not understanding what's going on. And these labels just exacerbate the feelings that they probably already have of things like shame and guilt, and which could lead to further isolation. So we know that when survivors feel isolated, when they feel things like shame or guilt, they are less likely to ask for help, less likely to talk to somebody about the abuse that they're experiencing, and less likely to seek out services. There are many barriers to care for a traumatic brain injury. There is not much data and research, and therefore not much funding on intimate partner violence and TBI because it is so underreported and so misdiagnosed. Survivors themselves often are not aware that they have a brain injury. So even if they have had, abuse that we mentioned before, such as strangulation or being choked or blunt force trauma to the head, they might not associate that as having a TBI. So that is why it is really important as domestic violence advocates that we're aware of this issue and that we can properly screen and talk to survivors about this, because they themselves may really have no awareness that they have a TBI. Even if they are aware or they suspect that they have a traumatic brain injury, often fear and shame may prevent them from disclosing, from seeking medical help, or from telling anybody what's going on. Like we mentioned earlier, they could be misdiagnosed even by other healthcare providers or social service providers. They could be diagnosed as having a mental health condition when the reality is they have a TBI. And then what could exacerbate that is the medications that are often prescribed for mental health diagnoses often make traumatic brain injuries worse. They can make the symptoms worse. So it's kind of like this vicious cycle of thinking that you have one mental health illness and being medicated for that, and your symptoms are not getting better. So you're not really getting to the root cause of what's going on. This was mentioned in the video, which I think is a really important point, that unlike athletes that might have concussions or a head injury, survivors of intimate partner violence don't have the luxury of recovering from a head injury before sustaining another one. So survivors of domestic violence, they're getting repeated head injuries because we know of the cycle of abuse. So they're not having time off to recover from a head injury or a brain injury before they're having that brain injury again. And we know that multiple TBIs in survivors, that can become really a problem where the symptoms could be worse and the symptoms are prolonged because it's multiple TBIs. So therefore, it becomes really important that we screen for TBIs in an effective way, in a trauma-informed way. When we screen for traumatic brain injury, we see positive outcomes while receiving services at a woman's place. We see that clients can get effective rehab. They're more likely to fulfill their personal goals. They have, long-term health outcomes are better. And also, it's important to screen because it is mandated by PCADV, our funder, the Pennsylvania Coalition Against Domestic Violence. So their language states that all shelter residents should be offered a traumatic brain injury screening and then offered resources and referrals and support as needed. And I would argue that it's not just important for our shelter residents and shelter clients here at A Woman's Place, that anyone getting services from us here at A Woman's Place could be screened for traumatic brain injury and then linked to resources and referrals. This is the HELP screening method for traumatic brain injury. So HELPS is an acronym. It's also pretty easy to remember. So it's HELPPS. So the first H, or the first letter is H, that's hit. Have you ever been hit in the head or have been hit in the head? Or I'm sorry, excuse me, have you ever hit your head or been hit in the head? E is emergency room. Were you ever seen in the emergency room or hospital? And if so, for what reason? Loss of consciousness. Did you lose consciousness? For how long and what reason? But again, just remembering that loss of consciousness is not necessarily an indicator of a traumatic brain injury. It's still important for us to ask that question. P is for problems. Did you have any problems after you were hit in the head? The other P is for pregnancy. Is there a chance that you may become pregnant or are pregnant? And the reason that is included in there is that we just know that intimate partner violence often starts or it gets worse during pregnancy. So pregnancy can be a very dangerous time for survivors of domestic violence. So it's important that we ask that question. S is sickness. Have you ever had any significant sickness after being hit in the head? So a score of 2 or higher indicates the potential need for follow-up services. So if they said yes to 2 or more of these, we then can offer follow-up resources and have that conversation with them about traumatic brain injury, and if they're interested in learning more about it and getting services for that. Working with survivors after a traumatic brain injury. So if you know that a survivor has a traumatic brain injury, just some things to keep in mind. Reducing bright lights and noises during meetings because of that sensitivity. Break safety planning or goal setting into smaller steps. So they might have an inability to kind of see the big picture. You might have to break things down into smaller steps, both for memory and concentration, also just for energy level. Review goals and plans often. So they might need reminders about what their goals are, or just checking in with them so they remember, what their goals and plans are for that day. Allowing extra time to complete tasks, helping survivors create to-do lists and checklists. So writing things down, seeing things visually, like either in a notebook or a whiteboard, might be really helpful for survivors of TBI. If safety allows, writing down things like appointments or the password to their phone or laptop or the contact information. Again, you might want to do a little safety planning around that about, is it safe and are they able to write those things down, or where can they write those things down that is going to be safe where no one else can see. So you can have that conversation with them. You also could just ask them, in addition to these things that I thought of that could be helpful when I work with you, are there other things that we can do to make you feel more comfortable or that would be helpful during meetings or during our time together? In the shelter setting, some ways that you can support a survivor, chores. So in the shelter setting, it's community living. There are certain expectations that people living in the shelter need to have certain chores or certain tasks completed, but that could be a problem or a barrier for someone with a traumatic brain injury. So either partnering them up with someone to complete the chore or allowing them to skip certain chores. Meeting attendance. So sometimes they're required to attend certain meetings or go to certain groups throughout the day. And that, again, that could be a challenge for someone with a traumatic brain injury. Flexible sleep-wake cycle. So like we were talking about earlier, sleep can be affected by a brain injury. So they can have a hard time waking up in the morning. They could need rest time or naps throughout the day. So kind of being flexible with that schedule. Reminding them of appointments often. Extra childcare resources so they can attend meetings and get certain tests done. Structured, consistent routines is important to their recovery of the brain injury. So even like working with them and coming up with a schedule where they're trying to wake up at the same time every day, trying to go to bed at the same time every day, and that routine can be really helpful for them. How else can a woman's place support survivors who may have a traumatic brain injury? I'll pause a moment just for you to think about that. And I could say the one thing that you can do is, again, whether you're a volunteer here at a woman's place or a staff member, is talk to the director or head of your department, whether you're working directly with clients or not. And talk about have they ever worked with survivors of a traumatic brain injury? What have they done? What has worked well? What can they do? Because I'm sure that they have some more support and more information that they can share for you. The other thing you could do is ask survivors. They have a lot of knowledge. They can share with us their experiences. They can share with us, what is helpful. And what is not, and they can share with us ways that we can support them. This is a list of resources. Some are local to Bucks County, some are statewide. The Pennsylvania Department of Health Brain Injury Program, they have a helpline that is listed there as well as a website. So that is statewide and their services are free. In Quakertown, which is the upper part of Bucks County, there is Success Rehab. They are not specific just to survivors of domestic violence. They provide rehab for people in Bucks County who have had brain injuries in general, but they have worked with our clients before who have had TBI, and their phone number and website is there. There's the Brain Injury Association of Pennsylvania. They have a resource line that's included there. Brain Steps is statewide in Pennsylvania. This is for students, not necessarily students who have experienced intimate partner violence, just in general support for students in Pennsylvania who have a brain injury. And then there's also an organization, Center on Partner Inflicted Brain Injury Program. So this nationwide center is for survivors of domestic violence who have a TBI, and their website is listed there. And there is my contact information. Once again, I'm Rochelle Daniels. I'm the medical educator here at A Woman's Place. I'm part of the education and training department. My email is rdaniels@awomansplace.org. I do a lot of training and education for medical and healthcare providers throughout Bucks County about domestic violence, about the importance of screening their clients, not only for domestic violence, but also for traumatic brain injury if it's relevant to their practice. And my email is there. You also can call our hotline at A Woman's Place or refer clients to our hotline if they have any questions about seeking our services or about our medical education program. And thank you for taking the time to view this recording.